This is E.W.CLAVILLE, and this is another Claville Report Synopsis. Today we're going to talk about healthcare. Should it be a basic right or a luxury in the United States? Across some countries, in the West, European countries more specifically, a lot of healthcare services, especially basic healthcare services, are taken care of by the government. It doesn't become the individual's responsibility, but rather the collective of the government itself. Many in the United States are now questioning whether that should be the model here. Should healthcare be a basic right to prevent illnesses and early death and to ensure that individuals are living healthy lives? Or should it remain a luxury governed by private insurance where individuals struggle to keep up with premiums just to get the basic care? We'll unpack that and more in the next Claville Report Synopsis. Healthcare in the United States. Should it be a basic right or should it be a luxury? According to this U.S. Gallup poll, it states that majority in the U.S. still say government should insure healthcare. As a matter of fact, it says 57% say the government should insure healthcare coverage for all persons in the U.S. 53% of adults that were polled favor healthcare system based on private insurance, 43% a government-run one, and 72% of Democrats and 13% of Republicans support a government-run system. Now, all of us have experienced healthcare checkups, maybe some of us healthcare scares, and others some major healthcare issues in which we've had to rely upon our phenomenal healthcare system in the United States. Now, bar none, our healthcare systems, people travel from around the world to receive the care that we have here in many instances. But it doesn't go unnoticed that our very own citizens, many struggle to obtain just the basic healthcare, checkups with their physician, annual checkups, the dentist, cleanings, eye examinations, and the like. These are some of the luxuries that many Americans simply cannot afford. And for those that are subsidized and helped by our government in order to do so, appointments are so long and drawn out that individuals really don't have a chance to really address the major issues that they're experiencing in their lives. So what ends up happening in a healthcare system such as ours that we have, private insurance tends to price individuals out. Premiums go up every single year. And if you're like me, you're paying your healthcare premiums, you're thankful for God that you're able to pay it and you have insurance, but it seems like every year the price escalates. But the care that you're getting and what covers it is a little less and a little less. Well, imagine if you're paying for not just yourself, but an entire family, how this can really impact how you live your life and how healthy you can be. So what happens when it becomes the government's responsibility? Well, let's take a look at what happened in 2009. Then President Barack Obama, according to this article, worked with Congress to pass the Affordable Care Act, ACA, also known by the popular name Obamacare. It expanded what's called access to private health insurance via new government mandates and then subsidies. The bill signed into law in 2010 until 2012. The public was divided, and of course, various attitudes about government's obligation for health care coverage changed from 2012 to 2014, where the clear majority said it was not the government's responsibility. But once again, the tide turned, and a slim majority felt that health care coverage was a government obligation. So since then, 51 to 57% of Americans held that same view. And then I believe that the overall factor in determining whether the government should run a healthcare system that helps all, at least for basic services, COVID. COVID was the equalizing factor to show that, yes, it can work, and yes, it should work, and it should be given an option here in the country. But like everything in our country, where you have a democracy, you have partisan views. So let's take a look at this Gallup partisan view as it relates to healthcare. The question posed was, do you think it's the responsibility of the federal government to make sure all Americans have health care coverage? Or is that not the responsibility of the government? 88% of Democrats said it was the responsibility of the government, while 28% of Republicans only agreed and 59% of independents. But 71% of Republicans said absolutely not, while only 10% of Democrats agreed that it wasn't, and 39% of those that are independent. Why does this matter? Well, when you look at the other issues of whether individuals prefer private health care in the U.S., let's take a look at that poll. 72% of Democrats prefer a government health-run system, while 26% do not. Well, they actually prefer a private. Of Republicans, only 13% approve or would like a government-run system, and 83% of Republicans said private insurance preference only. Likewise, independents, 46% favor government, 50% favor private insurance. What's the bottom line? According to this Gallup poll, Americans continue to hold a nuanced view of the U.S. healthcare system, with a majority saying government should ensure all Americans have coverage, but preferring that the system be funded privately. Also, partisans have fundamentally differing views on how health care should be delivered in the U.S. Democrats believe that support for a system where government not only guarantees coverage, but also provides health care, while Republicans remain wedded to the current system of private coverage. Whatever the case may be, it also showed Republicans are more unified against such medical care than they are against the idea that it is the government's job to make sure no American goes without. Make no mistake about it. COVID showed us one thing, what many Americans have been struggling with from the very beginning, and that's affordable health care coverage for just basic things. If we're looking at whether our country can be healthy without this particular system in place and being developed more, again, look no further than what we experienced during COVID. A government-run system that guarantees basic checkups, basic vaccinations, basic cleanings for teeth, basic eye exam, and basic services for all Americans was key, I believe, for a healthier country. But that depends on the policymakers. That depends on who we put in office. So this issue isn't going away, but we'll see exactly how it fleshes itself out. Is expanded Medicare the answer? Well, we had policy that tried to do it. And the policy was attacked. But moving forward, as we develop and evolve as a country, so will our policies. So this issue isn't going anywhere, and we'll be right here to unpack it even more. This has been another Claville Report Synopsis. We'll see you next time.